Gonna put a timer for 10 minutes and then you're gonna start. 2, 3, let's go.
Okay, hello, good evening. My name is Renda. I am one of the surgical doctors. How are you, Mr. John? So today I have been told that you don't want to stop your Warfarin pills. Can you please tell me why?
Hi, Miss Renda. My doctor told me that I shouldn't stop it because stopping might threaten my life.
Okay, Mr. John, I understand your frustration, but first of all, let me explain what Warfarin is. Warfarin is actually a drug or a medication, and it helps thin your blood throughout the prevention of formation of some chemicals. And we give it for patients to prevent the formation of clots in their body. In your case, we have given it to you to prevent the formation of clots around your artificial valve, Mr. John. As we are about to operate on you, warfarin has a risk of bleeding. It has a long duration of action. So if we stop it today, it will keep on working up to 5 days. So as we are going to operate on you, we need to stop it 5 days before your operation. So we need to change it to you to another drug or medication, which is called heparin. It's an injectable heparin, which is equivalent in action to warfarin, but it has a short duration of action, which is 12 hours before your operation, which will reduce the risk of bleeding. Okay? Did you understand what I said, Mr. John?
Yes, I understand, but why you want to stop this warfarin?
We want to stop it because warfarin has, as I said to you, it has a long duration of action. We want to operate on you. If we use warfarin, there is going to be a high risk of bleeding.
Okay,
And it has a warfarin will have a long duration of action, like 5 days. So we are not going to leave you unprotected, Mr. John. Okay, we are supporting you. We will give you another drug.
Okay.
Which is
You
called
said that
heparin.
you
Yes.
will give me another drug
Yes.
called
Yes.
heparin.
Yes.
Why you choose this heparin?
Because it has a short duration of action. It works. We can stop it up to 12 hours from your operation, and it has the same effect as warfarin with a reduced risk of bleeding.
And when I can resume my warfarin?
After the operation, after we are satisfied there is no risk of bleeding, we are going to give you we are going to allow you to continue.
How you can do that? How you
We
can
are going
satisfy that is no risk of bleeding?
we will do for you some blood tests to see what is happening inside your body. Then we are going to allow you to continue with the injectable heparin and the warfarin. As soon as in the blood test we find out that warfarin regained its activity, we will stop heparin and you will continue with the warfarin.
I don't agree. I don't understand that.
So, okay, Mr. Green, it's going to go as the following. As soon as you get outside, on what exactly? Can you please tell me on what exactly you don't agree on?
I don't agree to stop my warfarin. I need you to explain me more.
Okay, Mr. John, you need to be protected, right?
Okay.
You need to
Protected
stay
from
healthy
bleeding or what?
from the formation of clots around your artificial valve and from the risk of high bleeding. Okay, this is what we want to protect from you. Do you agree with us?
Yes, no problem. Go ahead.
Okay, if you keep on taking the warfarin, this is going to expose you to a risk of bleeding because it has a long duration of action. Okay?
Okay.
And so we will, at the same time, as I said to you, we're not going to leave you unprotected. We will give you another drug equivalent in action to warfarin, which is called heparin.
This heparin will protect me?
Yes, it will protect you.
I need to tell
definitely.
my doctor about that. My doctor told me that I shouldn't stop this warfarin. I need to talk it.
Okay, we can consult it with your doctor, and I am sure that because we will operate on you, your doctor will agree with us 100%.
When you will talk?
Okay, you can allow him to come to, you can give us his phone number so we can call him and discuss this with him. But believe me, Mr. John, what I said to you, all what we want is your best interest. All what we want is to make you safe and to
You
protect
will
you from
call
the
him.
clotting, from the blooding.
You will call him.
If you don't mind, you can give me his phone number. We can call
I
call
don't
him
have his
now.
number. I don't have his number.
Okay, Mr. Gain, then you have to focus with me. You have to concentrate with me. I understand your frustration. I understand your comprehension. But I understand that this is you
Please
are
don't
feeling
interrupt me.
anxious right
I
now.
don't have his number. What is the solution for that?
I can allow you to talk with my senior so we can discuss your case even further, Mr. John. I understand your frustration. I
No,
understand that
my
you are
senior.
anxious. But all what we are doing is for your best interest, Mr. John.
Okay. Okay, it is necessary to stay in the hospital prior to the operation.
Usually for individuals, we do not ask for them to stay in the hospital for the 5 days before the operation if they can inject themselves with this injectable heparin. In your case, since you cannot inject yourself, we are going to ask from our social workers to arrange a community nurse to visit you in your home and provide you with this injectable heparin. In case we were not able to do that, unfortunately, you have to come to the hospital and stay the 5 days before that.
Okay. It is necessary to stop my anti-anxiety medication before the operation.
What anti-anxiety medications are you taking, Sir John?
I'm not aware about it.
Okay, overall, there is no need to stop it. You can take it till the day of the operation only with a sip of a water.
Okay.
Okay, do you have any questions, Mr. John?
No, I have no any question.
So just to sum up, okay.
You tell me that you want to call my consultant.
What did you say?
You tell me that you want to call my consultant about stopping my warfarin.
I said because you wanted to feel comfortable, it's
Yes.
okay to discuss it with your
Yes,
doctor.
I would like to
Yes.
call him.
Yes, so we don't mind to discuss it and to talk with him.
Call him now,
while
please.
you are listening.
Call
You
him,
are.
please, now.
Do you have his phone number?
No.
So unfortunately, we cannot talk to your consultant or your doctor.
I need you to tell my doctor first. It's not my problem.
Okay, I'm really sorry, Mr. John. I understand you are anxious. I understand you are frustrated. But what
No,
about
I'm not anxious.
speaking
I just want to tell my doctor about stopping this warfarin pills.
Okay, can you listen to me so I can give you another option? What about another option?
Too much. And you said that you want to talk to my doctor. You didn't do it.
What about talking to my senior? What about talking to my doctor? So he's also a doctor with a specialty.
My doctor said that.
Okay, our doctor can also discuss it with you, our consultant, our senior. He can speak to you and explain it further so you can feel comfortable. But believe me, all doctors agree on the things I said to you. Stopping warfarin and replacing it with injectable heparin is for your best interest. Will protect you from the risk of bleeding, and it will protect you from the formation of clots around your artificial valve. I know this is frustrating. I know you feel anxious.
Yes,
At the
it's
same
so
time, all what
frustrating.
we do, this is all is for your best interest, and all doctors agree on that.
Okay, that's fine.
Do you have any questions, Mr. John?
No, I have no any question.
Okay, thank you, Mr. John. To sum up, we are going just to change, since we are going to operate on you, we will change your drug, which is warfarin, to an injectable heparin. Both of them are blood thinners. They thin your blood throughout the prevention of formation of some chemicals. Okay, thank you.
Thank you.
Yes, that's a good presentation. And Muhammad is becoming difficult for a purpose.
I'm really sorry, Randa.
No,
yes,
it's
that's
okay.
fine. No, that's the best practice. So expect a difficult patient, like what I did with the anxious mother, or like what Muhammad did in this one. The patient could take you in an empty loop. Like after you agree,
Mm.
suddenly he goes back. So expect that, and do your best to stay calm. I noticed your tone changed. You started to become angry or frustrated,
Yes.
and try to calm yourself. Even if the patient is even if the patient lost it, you should not lose it as a doctor.
Yes, and do
Uh,
apologize every time.
yes. So I think you just missed the summary point. You didn't finish it. Why? Because the patient is being difficult, and the
No,
examiner will
no.
understand
Sum
this.
up the discussion.
Yeah, but she didn't finish the sum up.
Yes.
Oh, okay.
Yeah, because you took her on an empty loop. Okay, so is there anyone who like want to ask any question before we conclude for today? I think our session was very nice. These stations are very common, and we put it this way because we started with the commonest stations that come to the exam. Okay, anyone
Anyone agree
does?
about that?
Yeah, is there anyone who like wanna?
I just want to have a small question.
Yeah,
When I said to him, I can consult it with your doctor, was it right or wrong? Did I miss anything?
No. Sometimes if we have a patient and he wants us to speak with the GB as a practice, I'm saying we can do
Mm.
that as long
Okay.
That's
as
right.
it's professional, as long as we just like we want to make the patient comfortable, right? So talking with his doctor is not an issue. For me, we
Okay.
even talk to his family, for example. If the patient said, please call my daughter, I want and update her about my situation, we do that. His daughter,
Okay.
his family, his doctor, that's a normal thing to do. It's not like outlier. It's not like something that you invented. It's a normal thing. Tomorrow we're gonna start the same time. We're gonna follow the schedule for the next two stations. Everyone is welcome to participate. See you tomorrow. Good luck.